Complications: gallstones can lead to several complications, including cholecystitis. Inflammation of the gallbladder is a common complication of gallstone. When gallstones block the bile duct, it can lead to inflammation and infection of the gallbladder. This condition can cause severe abdominal pain, nausea, vomiting, fever, and a risk of rupture or abscess formation in the gallbladder. Cholelithiasis, common bile duct stones. Gallstones can move from the gallbladder into the common bile duct, leading to obstruction. This blockage can cause jaundice, severe pain, dark urine, pale stools, and an infection such as cholangitis. Cholangitis, bile duct infection. Obstruction in the common bile duct can lead to bacterial infection. This is a serious infection of the bile ducts that can occur when gallstones block the flow of bile. Symptoms may include high fever, chills, abdominal pain, and jaundice. This condition is a medical emergency and can lead to sepsis if not treated promptly. Pancreatitis, inflammation of the pancreas. If the stone passes from the gallbladder and blocks the pancreatic duct, it can lead to inflammation of the pancreas. This can cause severe abdominal pain, nausea, vomiting, and in severe cases, organ failure. Acute pancreatitis can be life-threatening and may require hospitalization. Gallbladder empyema, pus in the gallbladder. When a gallbladder infection becomes severe, pus can collect within the gallbladder. This condition can cause high fever, chills, severe pain, and a palpable mass in the abdomen. It requires urgent medical intervention. Gallbladder perforation, rupture. If inflammation of the gallbladder is left untreated, it can lead to a tear or rupture. This leads to bile leaking into the abdominal cavity, causing peritonitis, inflammation of the abdominal lining, which is a life-threatening condition requiring emergency surgery. Gallstone ileus, a large gallstone can pass through the gallbladder wall into the small intestine, thus causing blockage/obstruction. It can lead to symptoms like severe abdominal pain, nausea, vomiting, and inability to pass gas or stool. Gallbladder cancer, though rare, gallstones increase the risk of gallbladder cancer. Gallbladder cancer is rare but has a poor prognosis, often diagnosed at an advanced stage. Moritzi syndrome, this rare complication occurs when a gallstone becomes lodged in the neck of the gallbladder or the cystic duct, compressing the common bile duct. This causes jaundice and biliary obstruction, requiring surgical intervention. Diagnosis/tests. History and physical examination. Gallstones involve a combination of physical examination, history taking, and imaging tests. Detailed patient history. Physical exam focusing on the abdomen. Murphy's sign, pain on deep inspiration when the examiner's fingers are placed under the rib cage on the right side, indicative of cholecystitis. Imaging tests. Abdominal X-ray, even though this is not the first choice, but an X-ray can sometimes detect gallstones that contain calcium. A standard X-ray of the abdomen is taken. Many gallstones are not visible on X-rays because they do not contain enough calcium. Ultrasound, the most common and non-invasive, and highly effective at detecting gallstones and signs of gallbladder inflammation. This is most preferred initial test for detecting gallstones. Computed tomography, CT, scan. A CT scan provides more detailed images and can show complications of gallstones. This may be useful for identifying complications such as gallbladder inflammation, bile duct obstruction, or pancreatitis, etc. Magnetic resonance cholangiopancreatography, MRCP, a special type of MRI that provides detailed images of the bile ducts, gallbladder, and pancreatic duct. This is non-invasive and highly detailed, making it excellent for identifying bile duct stones and other abnormalities. Endoscopic retrograde cholangiopancreatography, ERCP. ERCP is both a diagnostic and therapeutic procedure used to examine and treat problems in the bile and pancreatic ducts. A flexible endoscope is passed through the mouth, stomach, and into the duodenum. A dye is injected into the bile ducts, and X-rays are taken. It can detect and remove stones from the bile ducts. However, it is more invasive and carries some risks, so it is usually reserved for therapeutic purposes. Hepatobiliary immunodiacetic acid scan, HIDA, assesses the function of the gallbladder and bile ducts. A radioactive tracer is injected into a vein, and a special camera tracks its movement through the liver, gallbladder, and bile ducts. Useful for diagnosing gallbladder dysfunction and bile duct obstruction, even in the absence of visible stones. Endoscopic ultrasound, EUS combines endoscopy and ultrasound to obtain high-quality images of the gallbladder and bile ducts. A flexible tube with an ultrasound probe is inserted through the mouth and into the stomach and duodenum. Useful for detecting small stones and sludge that may not be visible on other imaging tests. Gallbladder ejection fraction, GBEF, test, measures the ability of the gallbladder to contract and empty in response to a fatty meal or medication.